strengthening research relationships in ways that respect and promote wellness in Indigenous communities and with Indigenous partners. So just some quick housekeeping. You've probably heard all of this already. There are details about the sessions, including Zoom links and the conference schedule. A self-care guide is in the chat. This presentation, as you notice, is being recorded. So if you'd like to ask any question anonymously, please feel free to send that to me in the private message in the chat, and I will bring it to the speaker's attention. It's my pleasure to introduce the presenters for this session. Dr. Lyana Patrick, Krystal Kumais-Ziprick, Tsatia, Adzich, and Jeska Slater. I'm going to provide some brief information. All of these people have so many amazing experiences, but I'll just really quickly give you some highlights, and hoping, Jeska, you will introduce yourselves when you have a chance to speak.
Jeska's not here. Jeska is not presenting. No.
Okay, great. All right. Thank you. Lyana is a member of the Stalatin First Nation and Acadian Scottish. She has worked as an education specialist for over 2 decades and was the first Indigenous doctoral graduate from the UBC School of Community and Regional Planning. She is currently an associate professor in the Faculty of Health Sciences at SFU. Dr. Patrick's work brings together the fields of public health, planning, and justice. Krystal is Plains Cree from the Treaty 6 Nation in Saskatchewan. She is new to the role as a research assistant for the health department of SFU. She's a small business owner in Surrey, BC, Simply Style Mobile Hair Design. She graduated from the PICS Best Program, the Chinook Aboriginal Management Program at the Sauder School of Business, and Community Leaders Igniting Change Program at the Beatty School of Business at SFU. She is also the PAC co-president for Kwantlen Park Secondary and vice president of the PAC for KB Woodward Elementary School. Krystal is a Skookum Lab ambassador and has been part of the Skookum Lab since the beginning. Tsatia is Cree Métis and a PhD student in the geography department at SFU and currently works as the research manager for the Skookum Health Research Project. Tsatia started her PhD in the fall of 2020, and her doctoral research is interested in what can be learned from transnational community dialogues between urban Indigenous women based in the Metro Vancouver area and the northeastern Siberian city of Yakutsk, Russia, about Indigenous self-determination and kinship-based governance structures. We ask that you please keep yourself muted during the presentation. If time permits, we'll have the Q&A. It's a short session. And at that time, obviously, remember to unmute. And Lyana, over to you.
Thank you so much all for joining us. As I've already mentioned, I'm joining you today from the ancestral unceded lands of the Musqueam, Squamish, and Tsleil-Waututh. And I'm very grateful to be an uninvited guest on these lands. So we are going to be presenting to you on a research project I've been working on called Skookum Health. And we're going to share about the project, which is building research relationships to strengthen health and well-being in Surrey. So I'm going to give you so next slide. I'll just give you a bit of an outline for what we are going to do. So I'll give you a little bit of the research background, and then I'm going to pass it over to Krystal to actually describe in more detail the work of Skookum Lab, and then also to provide some reflections on the process. And then Tsatia will give a bit of a research overview, what we've done to date and what we're going to continue to do. And then we're going to share some of the emerging themes that we've been hearing. We're really early in the process of looking at that. So these are just really kind of our preliminary things that are emerging as being really important in the community. Okay, next slide. So these are the research objectives, and just to foreground it, I actually, in early 2020, I think it was maybe January or February, I reached out to the Surrey Urban Indigenous Leadership Committee, who I'd done some work with a few years ago, and I wondered if they might be interested in partnering on a health research project, if they were working on anything. And my interest to partner with them came out of my knowledge of the work that they had done and having worked with them a little bit in the past. But also in my doctoral research, I'd worked a bit in Surrey, and I was really shocked at how it's a really fast growing community. It's got the highest number of urban Indigenous peoples in the province. And yet a lot of programs and services are concentrated in Vancouver. And I thought this is an area that I'd be really interested in partnering with and supporting because of those things. So it was really great timing because Swilsey was actually planning to focus on health issues through the work of the Skookum Lab. So that's how I got connected with Skookum Lab and started to learn about their work. So, you know, as an Indigenous researcher, it was really important that I spend some time establishing research partnerships and relationships, getting to know community members and organizations in Surrey. And that was, you know, a big part of this work and why I wanted to spend this time, this year and a bit, you know, introducing who I am and getting to know the community and what those priorities are. So the second objective was to actually start to identify some of those health needs and priorities of the community in Surrey. And, you know, we were really thinking about this holistically. So we were thinking about health, not just health service delivery or access to health programs, but also education and housing and, you know, health and all of its broad implications. And then the third objective was to support emerging community-based leadership networks of Indigenous peoples in Surrey. And so to that end, you know, it was really important that we hire as part of our research team, Krystal, who is our community research trainee, as a key part of it. And I was just reflecting on what Charlotte had shared earlier today about trainees as being immeasurably valuable. And this is absolutely true. You know, Krystal's an important part of our research team. So to that, and I'm gonna now pass it over to Krystal to talk about Skookum Lab and the work and her own reflections.
All right, Tense everybody. I'm going to tell you a little bit about Skookum Lab. We are located on the territory of the Semiahmoo, Kwantlen, Katzie, Coquitlam, Kakate, Tsawwassen First Nations, and Skookum means strong, powerful, and brave. Our goal is to make Surrey a great place for Indigenous children and youth. What is Skookum Lab? Skookum Lab addresses the high rate of Indigenous child and youth in poverty in Surrey by uniting people that experience poverty, making their lived experience visible, and honoring the wisdom of the urban Indigenous community. Skookum Lab's 5 primary objectives are: listen to how Indigenous children and youth in Surrey experience poverty, understand the complexities of systemic barriers that affect our community, cultivate collective wisdom and knowledge to address these barriers, initiate prototypes that reduce the number of Indigenous children and youth that experience poverty in Surrey, and build the capacity of community members and organizations to make and advocate the changes for benefits of our community. Skookum Lab is a social innovation lab that was developed through the City of Surrey and the Surrey Urban Indigenous Leadership Committee. And social innovation. So social innovation is about addressing social needs in new and innovative ways. One thing to think about is how Indigenous children and youth are experiencing poverty. Social innovation is necessary in Surrey because Western systems work have fallen short, and the 2016 census exemplifies this. Social innovation is a method used since time by Indigenous people. We have always been innovators. Indigenous communities were very inclusive. Our elders are honored. Youth were included in planning because one day they will take over the work. This star blanket is an articulation of the urban Indigenous community's needs. One of the very first engagement activities done with the guide groups in Surrey was the Guiding Youth Home Gala, and that's where I met Jeska and Sarah. And they were off in the corner of a room, and they had a whiteboard and star cutouts shaped like the stars for the blanket. And they were there just to ask the one question to the community. And it was, if there was one thing you could do to address child Indigenous youth and poverty in Surrey, what would you do? And then at another event, I met them at a powwow, one of the pop-up powwows in town. I was hired on Indigenous Peoples Day to ask the same question to the community. And every cutout was turned into a piece of the star and used as a visual representation of the data collected from these gatherings. Ultimately, the star blanket and the focus of Skookum Lab's work was cultivated from this information from Surrey residents. I thought this was such an amazing and creative way to engage with the community. Most responses related to the lack of housing, resources, and cultural connection. All right, and so Skookum Lab's guide groups have been foundational to our Indigenous Social Innovation Lab. They ensure that there is a broad range of perspectives on the experience of Indigenous child and youth in poverty in Surrey and assist us to center Indigenous wisdom and lived experience. More than that, however, guide groups have emerged as focal points for creating resiliency, hope, and supportive relationships through a culturally connected community of care in Surrey. And the participants in the guide groups create a safe space for participants to come together and share their wisdom and create supportive and resilient relationships grounded in culture and indigeneity. There are 6 guide groups. There's the youth guide group, caregiver guide group, elders guide group, the ambassadors guide group, the Métis guide group, and the service providers guide group. Community engagement and research. Skookum Lab has found that Indigenous residents feel invisible and disconnected from each other and displaced from their land and culture. These factors profoundly relate to their experience of urban Indigenous poverty in Surrey. For Indigenous people in Surrey, poverty is so much more than just income alone. From the lab's engagement findings, Skookum Lab developed the 4 C's as a theory of change which involves community belonging, connection to family, cultural awareness and visibility, and cash and financial security, which is speaking on reciprocity. So anytime we hire Indigenous people, we try to pay them at the same level as somebody with Western knowledge, because community and wisdom from elders, we hold that at the same level. Okay, Campfire gatherings are Skookum's indigenized social innovation design lab, a process that convenes key change agents to create innovative solutions. At a Skookum Lab Campfire in October of 2019, participants processed over a year's worth of community engagement and research information collected and surfaced 16 potential prototypes and 16 prototypes that they wanted to focus on based out of their research in Surrey. And the 6 main, they decided to focus on just 6 of them. And so the 6 main prototypes was the guide groups, the ambassador program, Indigenous housing, Indigenous gathering spaces, because we don't have any spaces to gather here. If we want to gather, we have to just go and have like a pop-up powwow somewhere, like where I met Jeska, where my daughter danced at a rec center where we rented for that day. And then understanding to action, racism through social innovation, and evaluating successes to scale up, an Indigenous social innovation evaluation team. Next, I'm just going to tell you a little bit about bead nights. And so pre-COVID, we could gather together, eat together, and be together. And then when COVID hit, there was a loss of connection for a lot of our community members. And so we went online through Zoom. We did a lot of check-ins. If we don't have some of our regulars on Zoom, we definitely call them and check in. We recently, with the Kamloops News, we've been doing a lot of community work, just hanging out with elders and making sure they're you know, taking them to the honoring events. And just I you know, had an elder come with me to work yesterday just to hang out. She brought her beadwork, and we just spent the day together. And I really appreciate being able to do that. And I'm sure she had such a good day too. And Skookum Ambassadors. So they started this program after the Caregiver Guide Group, and I was invited to join for as an ambassador. And being an urban Indigenous person, it makes me feel very disconnected from culture. And like I always have felt disconnected from culture. I grew up away from my family back home. We moved here as a baby, and my mom was fleeing like a pretty bad situation. So we kind of spent a lot of my early childhood hiding out. But since joining the Skookum Lab Caregiver Guide Group, being an adult, and the ambassador program, my family and I have been so grateful to be a part of the amazing group of strong, resilient, brave Indigenous people and allies. People that have taught me so much, not only culturally through bead nights and ambassador work and ribbon skirt workshops, but also with educating us towards becoming leaders in our community. Skookum Lab gave us the opportunity to attend a program through SFU, and the program is called Community Leaders Igniting Change. It was really motivating and gave me a lot of insight to my values and showed me that leadership is not about hierarchy, but it's all about putting your purpose into perspective and practice. Skookum Lab and Swilsey's goal is to make Surrey a great place for Indigenous children and youth. And their method always reminds me of the quote from the leadership class. The quote is by Joanne Swilla, and she says, "Leadership is not a person or a position. It is a relationship between people based on trust, obligation, commitment, and a shared vision of the good." And that quote really resonates with me and the way I want to work alongside Lyana and Tsatia and all the ambassadors and the guide groups that I work with. And so, with all the changes being made in Surrey. And I'm always really grateful to have the opportunity to try this new position as a research trainee. I don't think anybody who knows me would ever have guessed that I would be in this position, but I'm enjoying it so far. Some of the activities that Skookum Lab ambassadors do is we learn to make presentations to small and large groups of people. Today is my first time presenting on my own without any assistance and practice introducing ourselves as per each participant's cultural protocols, learn and practice about local Coast Salish protocols, and understand self-care and wellness through cultural activities. Mentorship by Indigenous leaders in Surrey, represent Skookum Lab and Swilsey at events and presentations, and being present in supporting local Indigenous community events, and learn about social innovation. And we learn how to facilitate small group sessions like guide groups. And we just had these photos taken. They took us for the day and gave us these beautiful skirts and gave us headshots. And I think that was my first headshot ever. So I'm pretty excited to be a part of that. And this is the elders blanketing ceremony. A blanketing ceremony shows our respect for those who have made important contributions to our community. We hold our elders to the utmost respect, the highest level. They are our wisdom. They are with us at every event we do. They're at B nights, Tuesdays and Thursdays. And Skookum Lab is rooted in the protocols of host nations. So this one was held at Kwantlen First Nations Longhouse, and we followed all of their protocols for Kwantlen territory. And Skookum Lab uplifts community wisdom by doing the work to build trusting relationships grounded on reciprocity and ethical engagement standards. And here are my reflections on this process. I just feel a lot of gratitude for having this opportunity again. I cannot believe how much work goes into writing one report. I will never take a report for granted. I will always never skim over one again. I'm going to appreciate them so much more. And I've learned so much so far about ethics, interviews, transcribing, and data analysis software. I'm learning all sorts of software that I never thought I didn't even know existed really. And I'm looking forward to more education and working with you both for the rest of the summer anyway. And I just want to thank you, Lyana and Tsatia, for bringing me on board and taking this chance, because I'm really excited for the position.
Thank you, Krystal, for that. I'm getting emotional. That was a really great overview of Skookum Lab.
Yeah.
Thank you.
So yeah, Krystal, it's like being in this position, having been working with you for the last month, it's taught me so much. So I just want to say everything that you said. We are so grateful to have you on our team. And you're a really important part of this project. So I'm going to give a bit of a research overview of what we've done to this point here. We started out by convening an advisory committee made up of representatives from Fraser Health, the Fraser Regional Aboriginal Friendship Center Association, Swilsey, the Surrey Urban Indigenous Leadership Committee, as well as Skookum Lab. And we try to meet with these folks. I think there's about 6 or 7 representatives on the advisory committee right now. We try to meet with them once a month or so, just giving updates about what we've done so far and asking for guidance on the next steps. We've done a literature review of Indigenous methodologies, urban Indigenous geographies, and Indigenous healthcare experiences. We've referred to some really important literatures, including the recent In Plain Sight report by Dr. Mary Ellen Turpel-Lafond. Dr. Eve Tuck's 2009 article has been really foundational to our work, Suspending Damage, a letter to communities and thinking about coming from a strength-based approach, as well as articles written by urban Indigenous healthcare advocates and professionals like Dr. Janet Smiley and her teams. In February, we held 2 community talking circles with members of the Skookum Lab guide groups. And in total, I think we had about 30 folks come and attend those talking circles. We've also been doing one-on-one interviews with healthcare providers, working with urban Indigenous community members in Surrey, BC. I think up to this point, we've done about 8 of those one-on-one interviews, and we have several more scheduled for this week and next week. We have hired a community elder as well, Dr. William Thomas. He's basically a doctorate. William Thomas with the FRAFCA and Fraser Health, as well as our wonderful Krystal, a community research trainee, to guide our process. And at the moment, we are in the process of ongoing thematic analysis of the talking circles, the interviews that we've done, as well as literature review. And next slide. And one exciting thing that we've got coming up here next in 2 weeks or so is we're having a virtual wellness day with everybody that has participated in the talking circles, as well as the one-on-one interviews, inviting people to come together and share a meal. And we have hopefully a drummer coming to welcome folks in. We have an elder who participated in the talking circles, offering teachings, as well as just kind of an opportunity to everybody come together and just be together in these really challenging, but cautiously optimistic times right now. So next slide. And so just we're going to briefly go through a few of the emerging and recurring themes that we're seeing throughout the talking circles and the one-on-one interviews. Oh, and I guess I should also say before just going back to what's coming next too, we're also working on preparing at some point a report for the Skookum Lab, and so we'll see, because all of this research is ultimately leading towards having community-based recommendations and ideas for what do we do with the work that we've done now and what comes next. So constantly referring back to the advisory group, to the guide groups, and to the other stakeholders that we are responsible to. And next slide. So the first theme that we've seen come up, obviously, and I'm sure so many people here can relate to this, is just feeling increased isolation in times of COVID-19. So bringing people together in the guide groups was a really nice opportunity for people who may not have seen their communities in a little while. I know a lot of elders were really excited to have the opportunity to come together and have a meal and just connect and talk. In the breaks, our talking circles were about 2 or 3 hours. And so in the breaks, it was just so much conversation and so much life and, oh, hey, I miss you. Like, it's so nice to see your face, which was really lovely. But yeah, a lot of people are experiencing a lot of isolation. So we just have some quotes over the next few slides related to the themes. And so this one was expressed by a guide group member. Through the pandemic, we just go back. Oh yeah, sorry. Through the pandemic, it's been interesting, I guess, because I've always struggled with my mental health. So I have had some really great revelations through the pandemic in maintaining that holistic perspective. But I think the isolation is sort of the mirror of that, not being able to connect with people. And I think that the community aspect and connecting with community and culture is a really, really big thing. I've seen so many people suffer through the pandemic, and it's just been the isolation part has been forgetting that there are other people out there that are also experiencing the same thing, and that we are in it together, but we're not allowed to be together.
Right, yeah, and I'll just speak really quickly, super quickly to the last 2 slides. So another important theme that emerged was just the importance of connection to family and land. Very much, also, I guess the thing that's really emerging and is clear is that these themes are all very much interconnected as well, and that we're doing this research in a very particular time where COVID-19 has impacted different people differentially. So I think, this is an important context that we'll have to be really attentive to. So the quote I'll read from a community member is, living in the city, it is hard to have that family connection from our territory. Because of COVID, we can't travel and can't go there on long weekends throughout the holidays. So that has been restrictive for us, but trying to keep that strong family connection back to our family in our territory during COVID is health and well-being for me. So it also highlights just how, people in the urban center also maintain strong connections to homelands as they are also, there's a spectrum of experiences, and some people are disconnected, but there are also a lot of strong connections. So this is kind of, something that we're, again, really attentive to and really want to understand better and how we can support that. So next slide. And then the importance of elders and intergenerational teachings is another really important thing that we heard. So the quote is, another thing that I think is important is connecting elders to youth again. That's essential for the elders and for the youth. The youth need to know their culture and their traditional ways, and the only way to learn is from the elders. And then the last quote I'll read out. I feel like it's important for my kids to know themselves, because I feel like when you grow up not knowing your culture, you feel like a part of you is missing, and you don't know what the emptiness is until you start learning about your culture. So I agree with the youth, getting together with the elders, and for them getting taught a lot of the traditional teachings. So one of the other intents of this research is to sort of understand and better engage with what is the methodology we should be using to understand the importance of culture to health and well-being. And Skookum Lab has started that really important work already. Krystal talked to it with the star blanket methodology. So how do we amplify that? How do we support that and continue that to support health and well-being in Surrey? This is something we will continue to explore and will become, I think, the foundation really of this work. Next slide is, I believe, yes, we just want to thank so much all of our partners, Skookum Lab, big time, Surrey Urban Indigenous Leadership Committee, the BC Support Unit, who is actually the one who has supported this research. So grateful for that support, and Simon Fraser University as well, where I come from, where I'm currently employed through. So I know we probably don't have, do we have time for questions? Masi Cho, thank you to my co-presenters. Thank you to everybody who attended and listened to our talk.
I think after that kind of inspirational presentation, if there is any question from the audience, I think we absolutely have time. People can always leave if they have to.